I'm Tim Byers. Welcome to this conference on behalf of the Colorado School of Public Health, where I'm the Associate Dean for Public Health Practice and the Director of the Center for Public Health Practice, which has organized this event. I want to first thank all the center staff. I won't ask them to raise their hands, but they're the people running around making things happen. Cerise Hunt and the rest of the staff have done a terrific job in putting this together. Thanks also to the Planning Committee for this conference. The Planning Committee, the symposium was planned by a committee representing many sectors that are related to this issue, including individuals from 10 different organizations that together provided, I think, complementary perspectives representing academia, state and local public health, state human services, community-based organizations, and federal drug enforcement. The agenda for today's meeting was developed and approved by this planning committee. And you'll recognize them today because they're the ones with the targets on their backs. So I'm really pleased that in the planning of the symposium, we've had inclusive input from many sectors. And as a result, I think the planning committee has created a very robust program for today. The purpose of today's symposium is to review both the evidence for health effects of marijuana and the public health-related policies and programs that we think may be relevant to Colorado's new marijuana laws. Our goal today is to increase the awareness about the scientific evidence that relates marijuana to health for public practice in Colorado. Now, having said that, there's a lot of important issues about marijuana that this symposium is not intended to address. And I want to mention those today. We may touch on them, but this symposium is not intended to talk about medical marijuana. A lot of important issues there we're not going to touch on. This symposium is not intended to revisit whether or not Amendment 64 is a good idea or a bad idea. There continues to be a lot of opinion about that, and that's not our purpose. We're not talking about uses of revenues from marijuana taxation. We're not talking about regulation of commerce. Those are all important issues, need to be dealt with, not subjects today. We're not talking about law enforcement and criminal justice issues. We're not talking about occupational health. Very important public health issues around occupational health for both commercial and home growing of marijuana, and we're not covering that today, not because it's not important, but because there's only so much we can do in one symposium. And then finally, we're not intentionally talking about what the research agenda should be. Now, clearly the speakers, many of them are going to point out inadequacies in the scientific evidence and may suggest some areas for research, but those of you who are not in academia will be relieved to know that we academicians are not going to get engaged in the feeding frenzy around what the best research ideas are today. Many of these subjects really could be separate conferences all their own and probably will into the future. So that's what we will not cover. Again, let me repeat, what we will do today is to review both the evidence for health effects of marijuana and the public health-related policies and programs that we think will be relevant to consider here in Colorado. Our goal then is to increase awareness of the evidence base, the scientific evidence base about marijuana for public health practitioners in Colorado. So the way we've organized today is the morning is all about the science, and then the afternoon is more about the public health programs. So who are you? You're 420 or so people. How many are not from Colorado? A lot of people here. Washington State, Wyoming, other surrounding states. How many are from academia? How many are from public health systems, agencies? I'd say most hands for that. How many from advocacy organizations? They're all up front for some reason. How many are from youth services or school services? How many are from mental health or substance abuse sectors? Healthcare sectors? How many are from private health consultant companies? And some of you raised your hand more than once. So it's a very diverse audience. Welcome to all of you. There are conflicts of interest we need to talk about, both personal, professional, and organizational conflicts. Each presenter will declare any personal or professional conflicts that they perceive they have relative to this topic. I wanted to talk a little bit about organizational conflicts of interest. There was on the planning committee and in the presentation today, organizations that have many responsibilities and vested interests in marijuana, from organizations like the Drug Policy Alliance that is involved in reforming our policies about drugs state by state and across America. The Washington State Liquor Board representative who's here, who has lots of organizational responsibilities. The Colorado Department of Public Health and Environment that has marijuana-related statutory policy issues. So there's organizations that have various kinds of organizational conflicts that I think you'll recognize. The funding for today's meeting comes from the Colorado School of Public Health. It's funding that's enabled through generous gifts from the various health-related foundations in Colorado, including the Colorado Health Foundation, the Colorado Trust, Caring for Colorado, Rose and Kaiser. And those gifts have enabled the Colorado School of Public Health to be community-facing, outward-facing, and to enable us to do work like we're doing today. The agenda is on your chairs. The speaker bios are also in the agenda. Therefore, we won't be taking the time to introduce speakers one at a time and tell you all the great schools they went to and all the great things that they've done. That's summarized in your speaker bios. And there's also an annotated bibliography, which I think many of you received ahead of the meeting, which is also printed in your booklet. I take personal responsibility for the annotations there and for the selection of the papers. The questions will be handled differently in the morning and in the afternoon. In the morning, we're going to have two sets of panelists that will be asking questions of each other. In the afternoon, the questions will come from the audience. The way we're going to manage the questions with this size of group is we're going to ask you to write them out. So there are cards in your agendas that you can write a question or a couple questions on, and then there are little boxes around the periphery for your question cards. We'll be collecting those throughout the day and organizing them into questions that we'll then address to speakers in the afternoon session. And if you run out of cards, there's extra cards near the boxes. So think of questions, write them down on the cards, and we'll deal with those this afternoon. All materials from today's meeting, including the agenda, bibliography, slides, and a video production that our staff is making as I speak, will be available by late next week, and maybe a white paper as well, depending on how much time I have next week to write one that summarizes what we're doing today. So you can see all that and get all that on publichealthpractice.org, which I thought was on the slide, but it isn't. But we'll make sure we get that on a slide before the end of the day. Oh, I know where it is. It's on your agenda. Publichealthpractice.org is written on your agenda, and that's where you can get all the materials, including all the slides, and later a video if you want to recommend somebody see one of the presentations. The presentations will be broken into different segments. Please turn off your cell phones, or at least put them on mute. This is one of a series of symposia that the Center for Public Health Practice has been carrying out. First ones we did were on Amendment 35, which is the tobacco tax. We did one on public health and the Affordable Care Act. Today's on public health and marijuana. And then one we're planning for June that you may be interested in as well is public health and oil and gas exploration and development in Colorado. So stay tuned for that. The evaluation will be by an email SurveyMonkey that you'll get at your emails following the meeting. So that's the introduction to the meeting. That's why we're here.